Bismillahirrahmanirrahim. Lipid profile test and its significance, also called LPT, reports total cholesterol, LDLs, HDLs, and triglycerides. LPT assess cardiovascular disease by considering the numbers along with other risk factors like family history, smoking, diabetes, and high blood pressure. On basis of LPT, the physician recommend for lifestyle changes such as improving diet, prevention, and getting more exercise or prescribing medications. Now we shall consider the numbers of LPT. In case of LPT, total cholesterol in normal range is 100 to 199 for 21 years old and above, and it is 75 to 169 milligram per deciliter for the people having the age of 20 years or less than 20 years. The LDLs, also called bad cholesterol, should be less than 100 mg, and the ideal value is 70 mg for heart patients. Above 200 mg, it is to be considered very high LDL, and triglycerides should be 150 or below 150. Ideal range is below 100 mg. And HDLs, also called good cholesterol, that should be 45 mg or 60 mg in the blood of the human being, and it is needed more for the women. Now, what are the function of the cholesterol in our body? It forms layers of cell membrane. It makes certain hormones, and it is used by the liver for making the bile acids, which are used for digestion. And the vitamin D in our body is to be produced by the cholesterol. Now, what are the roles of the LDLs and HDLs in our body? LDLs carries cholesterol from liver to the body cell, where the cholesterol is separated from the LDLs and used for the various function there. HDLs transport unused cholesterol from tissues back to the liver, where cholesterol is broken down to bile acids and excreted from the body. About 70% of the cholesterol in the blood is carried by LDLs and 30% by HDLs. LDL-bound cholesterol is responsible for the buildup of the plaque, and this is also called atherosclerotic buildup. HDLs reduce or retard atherosclerotic buildup and are thus beneficial for the health. Now, what is the difference between HDLs and LDLs? LDLs are low density, so excess of LDLs stay in the blood vessels and accumulates along the walls. More cholesterol in the blood, the more LDLs stick there on the inner walls of the blood vessels. This build up the plaque, and this plaque formation called atherosclerosis. The high density HDLs keep them moving through the blood vessels due to their high density and momentum. When HDLs move through the vessels, they pick excess cholesterol from the tissues of the blood vessels and carry the cholesterol back to the liver, where it is to be converted into the bile acids and excreted. LDL and HDLs are also different regarding their structures. LDLs contain 50% cholesterol and 20% proteins, but HDL contain 50% proteins and only 20% cholesterol. HDL molecules are larger than the LDL molecules. Now we see how LDLs cause stroke or the heart attack. So deposition of LDL makes plaque at inner walls of the blood vessels. If a broken piece of plaque or blood clot completely blocks an artery supplying blood to the brain, then it causes stroke. If this artery block, then the heart will be unfunction due to the block of the artery which is going to the heart, and this causes the heart attack. So the block of the artery is going to the heart cause heart attack, and the blockage of the artery going to the brain, if blocked, then that would be the cause of the stroke. HDLs are good cholesterol because it takes bad cholesterol LDLs out of arteries to reduce the chances of stroke and heart attack. Now we will see how the higher LDLs levels are to be built up and what are the causes of the LDLs build up in our body or in the cardiovascular system. So we can see aging is also a cause of the buildup of higher levels of the LDLs because aging slow metabolism and liver does not remove LDL. Similarly, excessive use of alcohol and smoking and tobacco also build up LDLs in the blood vessels. Obesity or the overweight of the body also build up LDLs. Similarly, the diet having high calories and saturated fats and trans fats and cholesterol also build up the LDLs. The disease like diabetes and kidney disease also causes the higher levels of the low density lipoproteins or LDLs. Similarly, use of corticosteroids and drugs of the high blood pressure also build LDLs in the body. Now, saturated and trans fats also raise the level of the LDLs in our body. Saturated fats are solid at room temperature. They are found in red meat, whole milk, and its products like cheese, butter, cream, coconut oil, and many baked and fried foods. Trans fats are solid hydrogenated oils. The example is dalda ghee. These fats have been banned in West due to its public health concerns. A diet rich in saturated and trans fats increases total cholesterol and the harmful LDLs in our blood and body. Now, what are the ailments which are produced in our bodies due to the atherosclerosis or the buildup of the plaque due to the higher level of the LDLs in our blood vessels, in our body tissues? So the ailments are the disease which are to be produced due to this plaque, and this is called atherosclerosis or chronic kidney disease, buildup of fluids, electrolytes, and waste due to impaired function of kidney and filtration of waste fluids from the blood vessels. Similarly, this also cause a decrease in the release of nitric oxide, which is vasodilator gas, and is very useful for the dilation of the arteries or the blood flow. So, due to atherosclerosis, the dysfunction of epithelial cell take place, so the release of nitric oxide is impaired or decreased. So the narrowing of the blood vessel occurs because the dilation due to nitric oxide release would be hampered due to the buildup of the plaque, the atherosclerosis. And this atherosclerosis also cause carotid artery disease, which is narrowing or blockage of artery which supplies blood to the brain and head. Similarly, if there would be atherosclerosis, the peripheral artery disease would occur, which is narrowing or blockage of artery which supplies blood from heart to the legs. And similarly, this cause coronary artery disease due to the narrowing or blockage of artery which supplies blood to the heart. How we can reduce the higher levels of LDLs which cause atherosclerosis or which cause the plaque in the inner side of our blood vessels and narrow it. So we can reduce the higher levels of LDLs by doing some things like this: eat the diets having higher amounts of natural fibers. Similarly, physical activity, deep breathing exercises will reduce LDLs, reduce the stress and have deep sleep. This will reduce LDLs and will boost the HDLs, the good cholesterol. So avoid fatty red meat, full fat, dairy products, bakery, fast foods, fried foods, food made of or made in saturated and trans fats. So if you will prevent this, the levels of LDLs would be decreased in the blood. Quits tobacco, both in form of smoke or smokeless. So tobacco is dangerous for the buildup of the LDLs. If you will quit tobacco, the smoky tobacco, and also the smokeless tobacco, then you can reduce LDLs by doing this. So eat fish, which has the ingredients like ecosapids, which also cause of the reduction of the LDLs and is helpful for the well-being of our body. Use effective drugs like statins along with sodium or the espagol. Marriage, high blood pressure, and diabetes reduce the weight or obesity. So these are the things. By doing these things, you can reduce the LDLs in your body, and then you can prevent the buildup of the plaque in the inner walls of the blood vessels or the atherosclerosis. Reducing LDLs by use of the dietary fibers. Now, dietary fibers blocks the absorption of cholesterol to blood in the digestive tract and thus reduced it, especially along with statin. The use of fiber like sodium, also called espagol, is effective. The high fiber foods like fruits and vegetables have less calories and slow digestion to help feel fuller for a long time. so cause the reduction in the LDLs. Unsaturated fats also decrease the LDLs in our body. Unsaturated fats, they are like the oils at room temperature. They are good sources of the fats like olive oil, peanut oil, canola, corn oil, sunflower oil, avocados, and nuts, and many more. So these are the sources of the unsaturated fats, and they cause the reduction of the bad cholesterol in our body, that is LDL. Polyunsaturated fats like omega-3 and omega-6 fatty acids are beneficial for health. They found in salmon, mackerel, and sardines, flax seeds, walnuts, canola oil, and soybean oil. So these are the sources of the unsaturated fatty acids, fatty fats, or the esters. So by using these oils, you can reduce the LDLs in your body. So high fibers food useful to reduce LDLs. They are oats, green peas, and split peas, citric fruits like quinoa, malta, lemon, carrots, mooli, gajar, barley, psyllium, asparagus, whole wheat flour, wheat bran, cauliflower, potatoes, lentils, green beans, black beans, pinto beans, kidney beans, chickpeas, raspberries, blackberries, pears, almonds, broccoli, and apples. They are the good sources of the high fibers, and the intake of the high fibers diets would cause the reduction of the LDLs and would be able to remove the bad cholesterol from your body. So you can use these high fiber foods for the well-being of your body to reduce the risk of the heart attack and the risk of the stroke due to the plaque or atherosclerosis. So this was a short about the health of the heart. So by decreasing the numbers as given in the second slides, or controlling the numbers of the cholesterol, the glycerides, and the LDLs and HDLs, you can take care of your health and brain and your overall bodies. Thank you very much.